my name is Kylie Rawls, and this will be my presentation for my Anatomy and Physiology course, and I will be discussing strokes. I will be talking about signs and symptoms, causes, the pathophysiology, diagnoses, lab work testing, prevention, treatment, medications, and epidemiology and some history about strokes. So strokes, the medical term for a stroke is cardiovascular accident. You may also hear it known as CVA, and most commonly it's known or called a stroke. So today I'm going to be focusing on two different kinds of strokes, ischemic stroke and hemorrhagic stroke. So an ischemic stroke occurs when there's an obstruction of blood flow, arterial blood flow to the brain from a thrombus formation. A thrombus is a clot. Or an embolus, which is a traveling clot, or hypoperfusion related to decreased blood flow to the brain. The lack of blood flow causes ischemia, which is a lack of oxygen to the cells and can lead to infarction, which is the clot. And that causes death to cells. A hemorrhagic stroke is an active bleed in the brain. So an ischemic stroke is the clot preventing blood flow, and the hemorrhagic is actually actively bleeding. So a hemorrhagic stroke is also known as intracranial hemorrhage. Primary causes of hemorrhagic strokes is uncontrolled hypertension. Other causes would be tumors, coagulation disorders, trauma, drug use, and with drug use, the most common drug to cause this would be cocaine. Signs and symptoms you may see with someone who's having a stroke would be hemiparesis, so that would be unilateral, so one-sided weakness, hemiplegia, so one-sided paralysis, slurred speech, aphasia, I'll go over 3 different kinds, facial paralysis or weakness. A common sign you would see would be a facial droop. Sometimes it can involve the eye, the cheek, so you would ask someone to smile, they'd smile, and this side or each side, one of them would be drooping. And they might not even know this is going on, okay? It can cause dysphagia, so difficulty swallowing, and in severe cases it can cause coma or death. The 3 different types of aphasia are receptive, expressive, and global. So aphasia, receptive would be someone might be talking to them and they don't understand what they're saying. Expressive is they understand what they're saying, but they cannot get the words out to say what they need to say. So it might sound like gibberish, but to them they think they're actually telling you, and it's very frustrating because they don't know that they're not making sense. And global would be both. So if you were out and about walking in a grocery store or sitting on the couch with family and someone were to collapse or maybe slump to the side, that would be maybe caused from some weakness or paralysis. If you approached them and they were having some facial drooping or confusion, they probably wouldn't be able to tell you what's going on. It is likely that person is having a stroke, so it is important to know the time and to call emergency personnel and get them there as soon as possible to get them to the hospital. An acronym we use in the hospital, we go by the Cincinnati Stroke Scale. So the acronym would be FAST, facial drooping, arm weakness, speech difficulties, and time. So the first 3, facial drooping, arm weakness, and speech difficulties, are all symptoms. And time, I'll explain later. And I'll tell you why that's important. Causes and risk factors for a stroke. Those who are at higher risk for having a stroke would be so obesity, a diet high in fat, diabetes, smoking, drug use, hormone therapy, such as birth control, hypertension, high cholesterol, heart disease, atrial fibrillation, which is a abnormal heart rhythm that puts you at higher risk for throwing a clot, and vascular diseases. So a combination of these puts you at a greater risk. So if there's a female who is taking birth control, if she smokes and has high blood pressure, she is at an increased risk for having a stroke, and women are at more risk than men to have a stroke. Some statistics, like I said, cardiovascular accidents, so a stroke, they are the leading cause of disability, third leading cause of death in women, and fifth leading cause of death in men in the United States. So like I said, women are more likely to have a stroke than men. 75% of strokes happen in those who are 65 or older. African American folk are at 150% greater risk than Caucasian folk. And those with hypertension or type 2 diabetes have a 4-fold increase on having a stroke, and an 8-fold increase in stroke mortality. Pathophysiology of a stroke. So how a stroke happens. A stroke occurs when there's a thrombus, so the blood clot is formed, or embolus, the traveling clot, occludes a vessel or an artery in the brain. Coagulation of a clot, so the sticking of platelets that form that clot, that aggregate together, or platelets and fibrin that adhere together to like a damaged wall of the artery or vessel, will form that clot. So gradually over time the artery can occlude, or if it's a clot that can travel, it would maybe occlude that artery. That would be called atherosclerosis, the occlusion of an artery of a clot that formed over time. That is an inflammatory disease process. Or a stroke can be caused, like I said, by an emboli, but there are different types of emboli. So it can be fat, air, tumor, foreign bodies, or a clot. Clots can also be in the heart and dislodged by having an abnormal heart rhythm, such as atrial fibrillation. That would cause an emboli and allowing it to travel to the brain and causing a stroke. Let's see, so diagnosing a stroke, it is done by a CT scan or a MRI. Sometimes a stroke cannot be visualized on a CT, so they would then recommend the patient get an MRI to get a better picture of the brain and find out if they're having a stroke and where they are having a stroke. Lab work that would need to be done would be a complete blood count, so a CBC. That would be important to check their hemoglobin and hematocrit levels, like if they were having a hemorrhagic stroke and they were bleeding. It would be important to know those levels. It'd also be important to know what blood type they are. It's important to get the chemistry. You would want to know their glucose levels and electrolyte levels. It's important to find out their glucose, because if someone is hypoglycemic, they have the exact same or similar symptoms to having a stroke. So weakness, confusion, difficulty talking. So it'd be important to find out what their glucose is as soon as they get to the hospital, to see are they just hypoglycemic, or are they maybe having a stroke? It's important to find out coagulation studies, such as a PTT or PTINR, if the patient had been on blood thinners. You'd want to find out a lipid level, their cholesterol, cardiac enzymes such as a troponin, and also a urine drug screen. As we talked about earlier, cocaine puts you at a higher risk for having a stroke. Ways to prevent having a stroke is you want to maintain a healthy lifestyle. Eat healthy, diet low in fat, low salt intake. It's important to control your glucose levels. especially those who are diabetic, to maintain healthy glucose level. Also taking your blood pressure if you have high blood pressure, then take it as prescribed. It's important to exercise regularly, quit smoking, and not to use drugs. Women who are on both birth control and have preeclampsia, so preeclampsia is having high blood pressure while you are pregnant, are at a higher risk for having a stroke. So it is important to let your doctor know if you have had those things. Treatments and medications. So I am a registered nurse, and I have seen quite a few of these patients come into the hospital on the emergency room side, and I've also worked inpatient, so I've had these patients after they have been diagnosed with a stroke. So upon entry to the ER, and a patient is complaining, or family member is complaining that they had been having some stroke-like symptoms, it's important to find out the onset of symptoms. And I'll explain why that is important. We talked about time in the acronym FAST. This is going to be why it's important to find out the time. So if someone is having a ischemic stroke, there is a medication that they can give. It is called tissue plasminogen activator, also known as TPA. Once it is confirmed that a patient is having an ischemic stroke, they could be eligible for having this drug. But there are certain qualifications to having this drug. First, they have to be within a 3-hour window. So if they meet the 3-hour requirement, you have to find out if they're on blood thinners, if they had any recent GI bleed, any kind of internal bleed, any kind of history of head trauma, recent surgeries, and it's important to find out those things. But because this drug is a clot busting drug, so it'll burst that clot and restore blood flow. If you had a history of bleeding, it could also cause uncontrollable bleeding. So it is very important to find out these things before this drug is administered. If you are following along, also in my PowerPoint, I have a table, a picture table of the requirements it would be to before administering this drug. Now, if the patient is having a hemorrhagic stroke, they would not be eligible because it is an active bleed. If they're having a hemorrhagic stroke, it would be important to get to surgery quickly to stop the bleed. So first thing, when a patient comes to the emergency room with signs and symptoms of a stroke, we are going to get them immediately to CT scan to rule out if it is ischemic or hemorrhagic. We'll be initiating IV, getting the blood work we talked about, hooking them up to a cardiac monitor, and getting a little picture of their heart and heart rhythm to see what's kind of going on there. Like I said, it's important to find out if it's ischemic or hemorrhagic. Now, if TPA is given, symptoms can literally resolve within minutes. So that weakness, that aphasia, that drooping can go away within minutes. This drug is literally life-saving for these patients. A little bit of history. So there are approximately 600,000 primary strokes, so first-time strokes every year in the United States. 87% are ischemic strokes, 10% are primary hemorrhagic, and 3 are subarachnoid hemorrhagic. Stroke is also the leading cause of disability, second leading cause of dementia, and 4th leading cause of death in the United States. And the estimated costs from a 2009 study on strokes was $68.9 billion. To conclude my presentation on strokes, as a nurse, it is extremely important and part of my job to educate patients, their family members, and the community on signs and symptoms and ways to prevent having a stroke, because prevention is absolutely key for your health. Things I would tell my patient would be to eat a healthy diet, maintain a healthy weight, to get regular exercise, limit their salt intake, take their medications as prescribed, and I would tell the patient and the family members to really educate themselves on signs and symptoms. So I'd go over their signs and symptoms if someone was having a stroke, and to be able to identify and know the onset of symptoms, because those things are literally life-saving, and to get them to the hospital immediately, because we have medication to save their life if they meet qualifications. So I hope you all enjoyed my presentation today and the PowerPoint on cardiovascular accidents. Have a good day.